Yeah.
We want to thank you guys for joining us as we're continuing the conversation from our CBS 42 News at 6 special edition, COVID-19 Now.
We got a chance to listen to a number of health experts. Dr. Michael Sack from UAB joined us, also Dr. Scott Harris, and Dr. Martha Dawson also joined us with the Black Nurses Association. But we want to make sure that you get a chance to have your voice, and we're going to have some others joining us right now. Let's bring them in to the conversation right now. First, we have with us as Council President William Parker. How you doing, sir?
Fine. How are you doing this evening?
Doing well. Okay. Let's see. We can. All right. Can you hear me?
Yes, sir.
We can't hear you, but we're going to be all right.
And,
yes, because of so much stuff going on.
Okay.
And you guys can hear us though, right?
yeah.
Good.
Yes, sir.
Chris Mosley is there as well.
He's with the Alabama Regional Medical Services, the Director of Marketing Outreach and Public Affairs, and Dr. Lindsay Harris, the President of the Alabama State Nurses Association. She was live with us at 4 o'clock.
Absolutely. And we want to start with Council President William Parker, and I'm going to get some headsets for us in a second. Want to get your thoughts. You got a chance to watch our COVID-19 Now and the state of COVID in Alabama right now. Want to get your thoughts on where we stand as a city that's battling through this pandemic.
Well, thank you, Art, and thank you all for inviting us to participate. You know, we're at the corner, as I like to talk about the analogy. We still have a lot more work to do. As you know, we're number 50 and Mississippi is ahead of us as relates to the vaccinations of residents within the city of Birmingham. We have a lot more work to do. I'm pleased that people are now starting to understand this is about life and death. And I think it's going to be important that we continue to hit the message that, listen, this is life and death. Vaccinations is the key for us. I will
say, I hope I'm not cutting you off. We're working to make sure we're able to hear you. But I have been watching. Yes, we hear you. We hear you now.
Okay.
Watching all of you for Word on the Street, which I think has been just a tremendous outreach to the community, answering all sorts of questions about the vaccine, which is really, really important. Dr. Harris, you moderate that panel. Do you guys feel you're being effective in reaching people?
Absolutely. I think that's one of the goals of President Parker, or his vision when he initially started this, was to educate and reach the community and just dispel those myths that are out there that, we've heard so many. And so he's gotten, very educated and knowledgeable people to come on, and we even have people wanting to join us. So I definitely believe it's been very effective, and we have really good participation and questions from our audience as well.
I know this week they opened Legion Field an extra day this weekend. We've gone out there a couple of times. We've seen lines of cars. Have you noticed the increase in people getting vaccinated?
Yeah, that's for me. Yes, we're pleased that we had over 175 residents to come out and receive the vaccination shot. Most of those were a lot of first-time residents, and so we want to continue to encourage everyone to please come out and get their vaccination shots. We're also offering those tickets to various events, and so we're going to look to double down and have additional incentives like they're doing in Gadsden with Vaccinate Gadsden. So I think that's going to be important for us to answer the challenge of President Biden to be able to provide some incentives, $100, $200, whatever it takes in order to make sure we vaccinate every resident as quickly as we possibly can.
And want to thank you all for joining us, and also who just joined us as well is Dr. Celeste Reese-Willis. And Dr. Celeste, thank you so much. Want to bring in this question that we see from one of our Facebook viewers. It says, I had fear for my grandkids under the age of 12. I really feel that y'all are just telling us what y'all want us to hear. What's your response to that person who's making that comment?
My first response is that she should talk to a health professional that she knows in the community and that she trusts, so that she doesn't have to feel as though someone is telling her something that she doesn't want to hear. And maybe they can share with her some hardcore numbers as to what is going on right now and what has transpired in the last 12 months in terms of infections, in terms of deaths, in terms of hospitalizations, and what it is we're seeing compared to what we saw exactly 1 year ago.
Chris Mosley, we was over the summer, we were in schools vaccinating communities, trying to get children to come out. How responsible is the community to attend vaccination clinics in the schools?
I didn't hear the last part of your question, Sarah. You said how?
How
Say that
responsible
one more time.
you guys get the turnout? How responsible is the community for having these clinics on site in schools to get children who are eligible to vaccinate?
Well, Sherry, let me say it this way. We've been in partnership with the Birmingham City Schools. The Birmingham City Council has been our wonderful, excellent partner. People initially responded very positively to vaccination and coming in to be vaccinated. As you know, we have mass vaccination sites from Hoover to North Birmingham. That has slowed down tremendously. However, I think that let me say it this way. What Dr. Sag said just previously is horrifying. He just told you, and you had three of your leading medical professionals in this state. Michael Sag is a national medical professional, but Michael Sag just told everybody that come the winter, come September, it may not be as good as we want. I think Dr. Willis just pointed out, to answer the question, I'm not here. I'm not here to like prove or convince anybody. I'm just going to tell the truth as I know the truth to be. Council President Parker has been our partner in this. Dr. Lindsay Harris, Dr. Celeste. So we've been on the front line. We don't have anything to prove to anybody on this broadcast tonight. What we come here to do is to speak the truth, to dispel misinformation and disinformation so that we can get people vaccinated in this community as quickly as possible. Why? Because people like Michael Sag are looking at the numbers. They know historically what has happened in pandemics. And so we should take heed to what these individuals tell us, be they Scott Harris, Dr. Martha Dawson, or Dr. Michael Sag. Because as I say, Chris Mosley don't have anything to prove to anybody as it relates to COVID-19 and what we are doing here out in this community. I've personally invested 17 months of my life into this, and it just feels as though we've taken about two to three steps back in terms of people getting vaccinated. So again, the response has been good, but we still have a long way to go, as Council President Parker always says, and it is our intention to throw the kitchen sink from here on out at COVID-19.
And Chris, you mentioned about throwing the kitchen sink at it. And Council President Parker, I want to ask you this. We're already seeing in Birmingham buildings that Birmingham-owned buildings, you have to wear masks. As we go forward, could more protocols be put in place, could more mandates be put in place to help people understand the seriousness of this? As we listen to Dr. Sag saying it's like a Category 5 hurricane still ahead. I haven't even reached that point yet.
Yes, I think the short answer, I think Mayor Wolfen indicated that earlier today that we could look at having a mask ordinance within the city of Birmingham. I think right now the important thing is let's do the things that we've been doing since last year. And let's make sure that we triple down our efforts. I want to thank you all at CBS 42 for hosting us tonight to help spread the word. We're going to continue to be here on the front line. The next part of it is we're looking to, utilizing our incentives, part of the $141 million, part of the American Rescue Plan. We've allocated $1.5 million, or proposed $1.5 million. We need to bring the mayor and the council together, build consensus immediately so that we can make sure that we have the funding and the incentives out in place sooner rather than later. We're in a race against time. This is life and death. President Biden and Vice President Harris and Congresswoman Sewell, they all have provided us the necessary funding, and we need to answer the challenge, and we need to do whatever is necessary in order to finally defeat COVID-19. Whatever we need to do, we will maximize every tool within our toolbox and then some. So we need to spend the whole $141 million to defeat COVID. We're prepared to do it. So we're going to be working around the clock, making sure we get the mayor, get the council together, community stakeholders together, understand the importance that we need to be able to get moving sooner rather than later. This is life versus death.
and thank all of you for the comments that you're getting. There are a lot of them. I don't have my glasses on, Art, so I can't see all of them. But let me ask you this, Councilor Parker, because you said, we need to do the things we did last year that we know work. One of those things was curfews. One of those things was masks in public places mandated. Is there a lack of political will to do that because of the economic pain that caused businesses?
No, let me just tell you a reason why. Not for me. Listen, this is about life and death. And if things continue to move in the direction, you could possibly see a mask ordinance before the city council next Tuesday. This is life and death, whatever it takes. So make no mistake about it. We will utilize whatever tool is in our toolbox. We're working on continuing to educate our community, washing your hands. If you feel ill, contact medical personnel. We will utilize whatever tool is in our toolbox to be able to make sure we finally defeat. That's part of that $141 million. If we need to move that and shift it, have an aggressive incentive plan like Gatson is doing, we're going to do that. We're working around the clock, having a lot of conversations, but we need to act, and we need to act now. Time is of the essence, and so we have to worry about life and protecting our residents. That is our top priority. Everything else is it'll take care of itself. This is about protecting the residents of the city of Birmingham and all 99 neighborhoods. That is the priority of the city of Birmingham. And I plan to make sure we do our part to make sure that's utilizing the funding part, $141 million, if that's utilizing the mask ordinance, whatever tool we have in our toolbox, we will maximize it from the city council's end.
It sounds like I can hear the urgency in your voice, President Parker, talking about using every tool in the toolbox. I want to get to Dr. Celeste, if you can, talk about where the needle is now. Are we starting to see vaccinations pick up as people are learning about the dangers of this Delta variant?
Yes, the rate of vaccinations, or the number of people getting vaccinated, is definitely increasing, but it's not nearly enough for us to decrease the spread of this virus across the community. So we're seeing an uptick in that, but we're at the same time, that we do COVID testing as well. We're seeing a lot more people for COVID testing, and it's kind of neck and neck, but it's not nearly enough. I think that what President Parker is talking about in terms of throwing the kitchen sink at it is definitely what needs to happen. A unified effort from all community leaders that understand that, what Dr. Sagg said, the hurricane is on the way. If you don't see it, if you don't see the rain, if you don't feel the urgency at this point, as healthcare professionals, I know that Dr. Lindsay will share this with you as well. As healthcare professionals, we are extremely concerned. In the last 18 years of practicing medicine and working for the first 16 years of my career was with an urgent care center, one of the largest in the Southeast, accustomed to caring for hundreds of people at a time in and out of winters, right? We've, made it through SARS, made it through Ebola, all of that. But this in particular, we are where we were a year ago, and we've already had over 600,000 Americans to die as a result of COVID-19. So at this point, the question we have to ask those people that are not vaccinated is, this is like playing Russian roulette. How many chances do you think that we're going to get in an opportunity to beat this infection? And so I think all efforts unified on that point can make a difference and can hopefully help to decrease the spread across our state and across the country.
Let me ask Dr. Lindsay Harris that particular question on the burnout factor for those people who are caring for COVID patients. Nobody really saw it coming that people would reject the vaccine. So that's the place we're in. So Dr. Harris, behind the scenes, what are you hearing psychologically from people who are caring for these patients?
So, Chair, I think I saw in the chat that came across the screen, Misty Stevens, who apparently is a nurse, and Misty said, "We are tired of seeing people die." And that is absolutely true. I mean, at this point, I think at the peak of COVID last year, there were 2,500 hospitalizations at the peak, and 50 to 60 people, almost 70 people were dying per day. Vaccinations has proven now, I think now we have, some of 1,500 people in hospitalized now, and we're seeing a lesser rate of deaths, but we're still seeing deaths. And those that are dying are those that are not vaccinated. So
Dr. Lindsay, I didn't want to touch on. I saw another post that was talking about people who are vaccinated dying. What's the truth behind those who are dying from COVID at this point?
So the truth is there's 96% of those that are not vaccinated, and Dr. Celeste can check me on that, but they're the ones that are so the 96%, they're the ones that are not dying. So they are the ones that they might have COVID, but they're not dying. So the ones that are not vaccinated, those are the ones that are dying.
Mm-hmm. Yeah. Let me, and this is, we're hearing from doctors, and I think for people who are listening, we had an infectious disease pediatric specialist, Dr. Cumberland, on last week, who talked about this variant. This is not the same COVID that we saw originally with the pandemic. Can one of you address just that part of it? Dr. Willis, talk about why people who don't know how to manage the pandemic, manage COVID, who may have not gotten vaccinated in 2020, didn't get vaccinated this year when it was available, why those people really need to understand that the Delta variant is a different thing altogether.
Okay, so great question. The main thing that we have to keep in mind is with this particular strain of COVID-19, it is not the same strain that we were dealing with a year ago. This strain is much more easily transmissible. People that are unvaccinated are 8 times more likely to get this particular strain of COVID-19, but it's very extremely contagious. It is, people are presenting, when they present with it, are presenting with more severe disease. In other words, before it was kind of like a gradual thing. They may not feel anything for a couple of days, and then, oh, I was around somebody 4 or 5 days ago. Now I have a runny nose, a little cough. People are presenting with chest pain. Oh, I'm waking up at night gasping for air. Oh, I can't make it to walk across the room. And these are 20 and 30-year-old healthy people. So we're not dealing with the same animal. This is a variant of COVID-19 that has had time to sit, chill back, and basically mutate or change, which is what viruses do. That's their activity or their behavior. It's had the opportunity to do that over the last few weeks and months in our country. So this is not the same infection. So you cannot reasonably think, oh, well, I had COVID before, I'll beat it this time, or I'll beat it again. No, that is not what's happening. At this point, you've got children in ICUs that are on ventilators. You have 20 and 30-year-olds begging for a vaccine before you intubate them. And at that point, it's way too late. And you're seeing deaths of people that are younger. So this is a completely different animal, much more ferocious of a virus, much more contagious, and much more highly transmissible, easier to get it.
Chris, I want to get over to you if I can. And you're talking about throwing everything at this. What's left to get the community to, number one, trust, and then to use that trust to get vaccinated or wear masks? Because you walk around and you see people act as if this pandemic is over.
Well, let me say this, Art. I believe that individuals should talk first and foremost to a medical professional, be it their doctor or their primary care physician, people such as Dr. Lindsay Harris, Dr. Celeste, Dr. David Hicks at the Jefferson County Health Department. In fact, the Jefferson County Health Department still has their COVID-19 call center available. You call that number at 205-858 2221. Those are the individuals that should answer your questions so that we can build trust. Outside of that, I guess I'm almost like Kay Ivey. What more do you want us to do? We've offered incentives. We fought the battle for access and equity so that everyone could have a vaccine within 5 miles of themselves. We've done community-based COVID-19 vaccinations as well as tests. What more do you want us to do? This is a issue of personal responsibility. I applaud Council President Parker and his leadership. He has been a staunch, unrelenting voice as it relates to this. We have long conversations in the morning as well as into the night about what more can we do. We are imploring and asking the public that you do your part as it relates to COVID-19 so that we can eradicate it. Because I think that one of the things that Dr. Celeste left out, we are talking about if we went from the alpha variant to the Delta variant, and now there's this new variant that you can read about online, do the research for yourself. But the Gamma variant is in the United States as well as in Alabama. And that will be the next iteration of COVID-19 if we don't begin to wear our masks, wash our hands, socially distance, and first and foremost, get a vaccine.
I also want to remind people that the place to go to get information on how to get a vaccine is vaccines, vaccines.gov. And you can find out where to go get vaccinated in your area.
I know the American Hospital Association launched a campaign to address those people who are having hesitancy. Dr. Martha Gusson said in our 6 o'clock special that we need to hear more of these stories. One of the gentlemen we had, Bill Lazenby, who shared his COVID story, who shared that he was hesitant to get vaccinated. And after being in the ICU, even listening to him, you can kind of hear him still kind of struggle. He's in recovery from COVID, but telling people, urging them to get vaccinated. From all of you on the panel, the personal stories of people that you know who have been affected by this virus, people who have lost their lives, is that something that other people are relating to, the personal death stories?
Yeah, absolutely, Sherry. I was talking to a certified registered nurse practitioner today. Wonderful young lady by the name of Crystal Stevens. She is a pulmonary CRNP. Crystal sees patients on a regular basis, and she was just telling me about the case because we hear them every day about people who say, well, after they're intubated, I wish I would have gotten the vaccine. Okay. It's too late by that point in time for medical professionals like Lindsay and Dr. Celeste to really help you out. That's why I think they employ you to do it. So we are asking people who have been affected by this to tell your personal stories, not only to your friends and your family, but to the community. See, the people in the community need to hear how horrified and how sick you were, how scared you were that you couldn't breathe. I heard one person who recovered from COVID-19 say that it felt as though they had a Ziploc bag over their head and that the Ziploc bag had been, totally closed off. Why? Because they could not breathe. Okay. You're talking about 2, 3, 4% of oxygen being able to be breathing. So again, we are asking people and imploring people in the community to really tell your personal stories so that we can have an impact. This is a person-to-person, hand-to-hand fight that we're in, and we're all willing to do what we need to do to, to educate more people.
I guess we're going through some of the stories. Dr. Celeste, you have a story that you can share with us from someone who wished they had gotten vaccinated. And then I want to also address some of the people who are putting in comments talking about the vaccines that do not work. And because those comments are there, I think we need to make sure that we address all the information out there. And I want you to address that as well.
Okay, and I'm sorry, Art, which part you want me to address? The comment that was made about?
I want you to do that first because I think that's important because that comment, I keep seeing that comment come up over and over. In this case, it was parent or a family member who was vaccinated caught COVID and I think passed away. And so they're saying the vaccine does not work. How do you help them understand that many more people are living with the vaccine and not dying?
Okay, so the first thing that I would tell you is that there are 164 million people in the United States that are fully vaccinated, and the percentage of those people that have had a severe complication such as death as a result of a vaccine are minimal, extremely minimal compared to the number of people that you would compare having a COVID infection that end up ending in death. That's just the reality of where we are. Most of the vaccines, most of the side effects of the vaccines are minimal in comparison to what you will experience if you are positive with COVID-19. Once you have COVID-19, if you get an infection, it's not a situation wherein you can do something then to arrest what is going on in your body. At that point, you're way too late to get the vaccine. There have been so many stories that I could tell you about patients who have been in regret about, oh, I didn't get the vaccine. I just don't trust it. It was made too soon. All of those things, which we can refute with data, with the fact that at this point, how many millions of people have been vaccinated and how many lives have been saved compared to, because if you look at where we were a year ago, we didn't have a vaccine. So when people got COVID, it was a situation wherein, you try and treat them with medications that we know can help with COVID in some patients, and that still could end in death for that particular patient, right? So now we have a vaccine, and what we know that the vaccines do, we know that the vaccines decrease hospitalization rates. We know that they decrease the amount of deaths. We know that they decrease the severity of disease. We know that because we're seeing it, and we're seeing it now. So to compare and say, and there are a lot of other mitigating factors. I don't have that patient's history to know if there's something else that could have contributed to the passing of that patient. But what I will say is that we know that these vaccines have been tremendous in saving life compared to where we were a year ago.
I want to go back to this part about masks because there's still a group of people, children younger than 20, who cannot be vaccinated. There seems to be this sort of ambivalence about masking for people who are vaccinated there in these spaces. Councilor Parker, can you talk? You pretty much said you're prepared to do whatever. That means we have to wear masks. We're prepared to do that. But can you specifically on that, like, how can you ratchet up what happened last year with the masks in public places, at least in the city?
Well, let me, when we put the initial mask ordinance in place, there was some pushback from some of the communities, but I think people, understood that the importance of wearing the mask was not only to protect others, but to protect themselves. And so as we moved along, in the summer months, and it got warmer, and a lot of people indicate, okay, let's do away with it. But we're at a crossroads now, and so whatever tool we need to utilize, whether that's bringing the mask ordinance back, we will do what is necessary. So we need everyone to please go out and get vaccinated as quickly as we possibly can. But it was successful before, and we need to utilize it again. There won't be any hesitation on my part to bring the item before the city council, the mayor, and ask that we impose it. And so we have to protect not only others, we need to protect ourselves. And this is about life and death. And whatever tool we need to utilize, I keep reiterating that, whatever tool we need to utilize, we're going to do it. And sooner rather than later. It's a very alarming what Dr. Sag said earlier, and we need to take heed to it. This is very, very, very serious, and it's about life and death.
As we move to the 7 o'clock hour, I want to get final thoughts on what do you say to the unvaccinated? And I know you just spoke, but I want each one of you to just give your final thoughts, starting with you, Councilor Parker, President Parker. your final thoughts to someone who is unvaccinated at this point.
And could you also
If you have concerns, I know a lot of people sitting on the fence, and you've heard a lot of misinformation. Please just consult your medical personnel. If you need to call the health department to talk to Dr. Hicks and others, Dr. Williford, Dr. Wilson, we have a lot of medical personnel. We need to make sure you please get vaccinated. This is about life and death. I just don't know however way to put it. Life and death. A lot of people are planning for going to football season or going to events later, the Magic City Classic. If you're not around, you won't be able to participate. And so we need you to take the heat. We need you to please get vaccinated as quickly as possible. And we need to make sure they take their family and their friends. This is just a race against time. And we need to do anything and everything possible. So I would just appeal to all of those, please go get vaccinated. Don't fake it and not wear a mask. And then you're thinking you walk around, you hadn't been vaccinated. Please get vaccinated. I think that's just a message. Vaccination, vaccinations. That is the cure, and that is the formula for us to be able to have a new normal as we move forward into the fall.
Dr. Just give us your opposing thoughts. Will you factor in the part of the people who haven't gone back to get their second vaccine dose? How that is kind of playing into the equation?
Okay. Those individuals that are not fully vaccinated are not achieving the efficacy of the vaccine that you could if you had both doses. You're not fully covered. So number one is and it's not too late, even if you got it back in March or whenever, go ahead and get the vaccine now. There are vaccine clinics everywhere. Clinics are open every day that will allow you to get a vaccine. The question the question I have for the people that are unvaccinated is, where do you want to be in 2022? It is August of 2021. We couldn't imagine a year ago we would be where we are now. It reminds me of the analogy about the drowning man. A rowboat comes by to try and save him. We could say that that's our mask when we realized the mask would work, right? He didn't go with the rowboat. Motorboat comes by. He passes up the motorboat. That's our vaccine, right? And then the helicopter comes by, passes that up, gets to heaven, and is like, okay, God, why didn't you save me? God said, I sent a rowboat, I sent a mask, I sent a vaccine, and now I'm sending a message about the fact it's going to take unified effort of every community leader, every person that's a part of this beautiful city of Birmingham and this beautiful state of Alabama, a unified effort of everyone to help get everyone vaccinated and realize that everything we do is tied to one another. What I do in my house is going to affect what happens in your house. And we're seeing the manifestation of that right now in terms of this surge of the Delta variant. Where do you want to be in 2022? Get vaccinated.
Very well. Dr. Lindsay.
And I too concur with both President Parker and Dr. Willis. I will say this as a fact check for myself. So unvaccinated people here in the state of Alabama represent 96.2% of the deaths. So unvaccinated people represent 96.2% of the deaths. So that number is astounding. So we must be diligent and get vaccinated, get fully vaccinated. I should start saying now, we must get fully vaccinated and in order to move forward.
Thank you very much. And Brother Mosley, we're going to let you up.
Oh, so y'all giving me the drop the mic moment, huh?
Out there on the front line.
Drop the mic moment. So this is what I say. This is what I say to the people. Okay. If you're unvaccinated, there's no judgment here. None. Absolutely none. We want you to be healthy. We want you to exercise good judgment. We want you to be here for your friends and your family. Vaccines are safe. They're available and they're free. I think Art indicated that you can go to vaccines.gov to find your where they are available in your community. You can call 205-858-2221, which is the call center for the Jefferson County Department of Health, because we want people to be, as I say, we want them to be here for your family, your friends. Dr. Willis just talked about it. One of the things that I always tell folks, I've been doing this for a very long time, over a year and a half. When William Parker, Council President Parker, and I started doing Word on the Street in March, I predicted that we need to have at least 70 to 80% of the people vaccinated by the end of June. That date has come and gone. The Biden administration, as you know, just recently reached the 70% threshold. We are at 35% here in Jefferson County. We have a long way to go. I thank you, Sherry. I thank you, Art, for having this opportunity for us to talk to people, because as you know, this is going to be an ongoing process, and we are in a marathon, not a sprint.
Indeed, we want to say thank you to all of you. Let's bring y'all back in so we can say.
And to thank all of you, especially for just bringing facts to these people who are posting on Facebook and listening to you as people who still have questions, that there are people in the community willing to answer your questions from the health and medical community, to answer your questions with facts, to debunk misinformation. So thank you so much for being so open to sharing.
Thank you. And maybe you can join us next Monday night. We'll have our next Word on the Street at 6:30. So we'd love to have you all come in and join us.
Sherry's there a lot of the time.
I listen.
Yeah, Sherry's there a lot of the time.
I know we want you all not to listen. We want you all to be a part of it. I think that's what we got to do. And I'll tell you real quick, Monday night we had, Monday afternoon, Monday morning, we had all the fraternities and sororities and also a lot of the health organization. It's going to take all of that. I think Dr. Celeste is great. It's perfect. It's dead on. It's going to take all of us working together. So we'll invite you all to be a part of our Monday night Word on the Street. We're going to be doing it every Monday night as we move forward to make sure that we can continue to address the concerns. But thank you all at CBS 42. Thank you. You all have been great partners since not only, for years, but also during this pandemic that started in March 2020. And I just want to tell you all, thank you for all of your assistance and making sure that we've been great media partners and able to communicate and educate the community. So thank you so much.
Thank you.
Thank you.
And we will see you on Monday.
See you Monday.
All right. Thank you.
All right. Those of you who are watching there, and we want to thank you guys for joining us. And if you still have questions, please leave them in the comments section there. But again, vaccines.gov. If you want to get a vaccine, and if you listen to our health professionals, they will tell you that you need to do that. Go to vaccines.gov and you can get that.
The American Hospital Association has really good information. Some people are still wondering when the FDA approval will come. Information from our health leaders on that information as well. So seek out knowledgeable organizations to get the facts. That, I think, hesitancy. We understand that people do have questions, and as journalists, we all do.
Yes.
So
Absolutely.
We also know that you can go to the source and get the answers. And so that's what we want to do for you, and hopefully help facilitate some of that too.
And thank you for joining us for the CBS 42 special edition of COVID-19 Now after the show, where we're able to talk with you. And thank you for those of you who have left comments with us. And make sure you join us for the CBS 42 News at 10 o'clock.